you need to stick to the approach as well.
Yeah, that becomes a issue really. Yes.
Yeah. So the tips I can give you in this kind of station, Dr. Ashish.
Yeah.
When there is a learning difficulty, learning disability, there might be different kinds of learning difficulties or disabilities. So ask from the
Correct.
patient what kind of learning difficulty is he having, because according to his learning difficulty we will be tapering our management. Suppose he is
Yeah.
having difficulty in reading, then obviously you cannot give the printed material to him, and then in that case you can talk about some kind of alarms, okay, to remind him about the medication, these kind of things. If he cannot hear properly, then you can talk. If he can read and can't hear, then you can talk about some printed material, some leaflets, these kind of things.
Yeah, I thought of that, but I was reluctant to ask that because I was scared of offending the patient. So I need to find out a good way to ask the patient what kind of learning disability he has.
So this was written in your task, right? So you can say that I can read from your notes that you are having some problem with your learning. Can you please tell me
Okay.
about it? What
Yeah.
problem you are having?
Okay. Okay. I'll stick to that then.
Yeah. So it was mentioned in your task, because according to that problem you will be tapering your management.
Uh, yes, of course. Yes.
And also in the beginning, when you know that it's a learning difficulty, someone with learning difficulty, so you can say that, so Jill, I will be talking to you about some things, but at any time you feel that I'm going too fast or you are not able to understand anything, you can stop me, and I will be more than happy to repeat those things for you.
Yeah, I missed on that. Very important. Yes.
Similarly, according to the learning difficulty, you can talk about in the management, you can talk about some aids.
Which is stronger than ever.
Please
This is
mute
about
yourself.
you trying to change my environment, which was perfect the way it was.
Thank you. All right. So what we can do here is that there are a few things that you need to talk about here, Dr. Ashish. You cannot miss those things. When it
Yeah.
comes to diabetes, when it comes to any chronic medical condition, hypertension, diabetes, so in these kind of condition, if patient is coming with learning difficulty, we need to know about uh, dose. Okay, so how you will say dose? You will not say dose, you can say how much you are taking.
Yeah. Correct.
Okay, and you can ask him to, like, if he's taking it by himself, then you can ask him to tell you how much he's taking. So it is mentioned in the task 30 units and 15 units, so make sure he's taking it at the proper dose.
Yeah. So it is important to quantify how much this is. Yes. Correct.
Yeah, you need to know
Yeah.
the dose
And
frequency, how
yes,
many
of
times
course.
she told you already that she's taking it twice a day. Okay, that is done. And the dose you need to ask specifically. Similarly, you need to ask about side effects as well.
Okay.
So if he is missing, she mentioned that she missed the dose, so you can ask her why. What was the reason for that? Was it because of
Mm,
any side effect, and did she forgot to take it? Okay, ask the reason why she missed the dose.
yeah.
And that was a big blunder in the beginning. When she said Mary, you said, oh, the nurse. How you know Mary is the nurse? Mary can be a doctor
Yeah.
as well.
Correct.
Mary can be
Correct.
anything,
Correct.
anyone.
Yes.
So
Yeah.
ask her
That was sounding
specifically,
descriptive. Yeah.
because these are the things that make you, they think that you are scripted.
Correct.
So if you are not sure, don't assume anything, ask from the patient.
Yeah. Of course. Yes.
Okay, and then did you explore diet?
No, I did not. See, this is the problem. No, you don't have enough time, and yet then you cannot be fast because the patient has learning disability. So you are kind of struggling. otherwise also I'm always struggling with the time management. And
Yeah.
in learning disability, it becomes even more difficult to manage the time because you have to go slow. And if you go slow, you tend to miss on important things like I did. And that is what I need to probably practice more.
Yeah, I will tell you the solution for that. But you went slow, and
Yeah.
that was good. Okay, your consultation was not looking like you are rushing and you are interrupting patient. Because if you are interrupting patient, if you are not listening to patient, then you are in trouble. Otherwise, if you are going slow and you are covering important things side by side, then you are fine. So what you can do in this kind of session is, basically this is an approach for these kind of counseling station. I have written it down here, and
Okay.
you can use this approach. Okay, first of all, when patient is coming, gather some data about his previous visit or admission, and then ask from him what happened at that time and what was the advice he received. You did that part. Okay, after
Okay.
that, when you are in control, you need to know what kind of advice, as you already asked him, what kind of advice was given to him. So it was dietary advice or medication. So if it was a dietary advice, then you can cover that. Are you following that? Are, by any chance, are you taking any sweets, any sugary things right now?
Okay.
Okay, so you can tackle the diet issue at any time. You can cover it here in discharge advice as well. You can ask from her what were the things they told you when you got discharged from here. They gave
Yeah.
you some
Yes.
medication as well. So are you taking them regularly as prescribed? Okay,
Yes.
so can you please tell me, how are you taking it? How many times you are taking it? How much you are taking it? By any chance, are you having any problem because of that? Are you checking your sugar levels every day?
Yeah. Correct.
And then ask about few complications as well, if you have time. I know these are a lot of things. So the trick is that if there is anything that is missing, like if he is taking the medication instead of twice a day, he is taking it once a day. So you can give the advice about the compliance there and then, without waiting for the management part.
Yeah. Yeah. Of course. Yeah. There we can save the time. Yes.
Give him advice there and then. If he is not taking it regularly, you can advise him about that. You need to take it like 30 units in the morning, 15 units in the evening, regularly. Don't skip any dose. If you are having any side effects, then please talk to us about that, and don't miss your insulin dose.
Yes.
Okay, most important side effect that you should talk about here is hypoglycemia. You covered that
Yes.
safety netting thing, and you can talk about like, if he can read properly, then you can give him the symptom card or symptom list as well. If you are having these symptoms, then you can call 999. Don't
Yes.
skip the you gave him advices, but when you are asking it in the data gathering, at that time you can, if there is anything that is missing, you can give the advice there and then.
Yes. Of course. Yeah.
Okay, and then that current symptoms, that how are you doing now, explore that as well. By any chance he is having any problem, so if he is not taking medication, there might be something in his mind why he skipped the dose.
Yes. I did not explore that. Yes. I missed
Yeah,
on that.
yeah. And also when you are in DESA, so in PMH, past medical history, when you asked about medication, after that ask about any other medication you are on, any allergies, it's okay, then move to DESA. So in DESA, when you are talking about diet, give the advice for his diet modification there and then.
Okay.
And similarly, if he's not physically active, then you can advise him. One thing is that you can advise him after asking about diet, and another thing is that cover DESA first, ask about diet, exercise, smoking, alcohol, and at the end cover your risk factor management here.
Okay.
Okay, and examination and investigation have already been done, so you need to disclose them as well. When you are talking about the risk factor assessment, at that time you can disclose that you did that. Your structure was fine, Dr. Ashish. You just skip few things, and I think if you were doing them side by side, then I will not advise to do this in all the stations, because sometimes you get lost and you forget the structure while you are doing that. So in these particular kind of station, when the station is very long, so in those stations you can advise about compliance, or if he's not taking the dose properly, you can advise about that there and then you can cover the rest of the things in management.
Yeah. Yes,
In the
that's a good advice.
Yeah, because in the management, then you will not be having much things to talk about. Even if it is 1 minute left, then you can try to summarize all the things that are left in 1 minute, and you can cover your management.
Yes.
Okay, so the mnemonic I made for the management is this forms. F is for further investigation. First of all, you need to disclose your results, which have already been done. So after that, talk about some further investigation, like special blood test, that by that we mean to say HbA1c. Similarly, you can
Yes.
talk about kidney function, liver function test, and if there is an eye checkup, foot care, examining his foot as well. All the complication of diabetes, you can talk about those, checking for those complications in the further investigations.
Yes. Okay.
Okay, and then advice. A is for advice, R is for risk factor. Advice about risk factor and medication. Okay, so risk factor you have already covered. If medication you have already covered, then only some referrals will be left. If there is any like relevant referral here, like referral to the dietitian, referral to the gym instructor if BMI is high, then you can talk about referrals in the management if you have covered other things. If you have not talked about DESA, then you talk about DESA here.
Yeah.
Cover the things that are left. And S is for safety netting and follow-up. So you did safety netting. You can talk about further follow-ups as well, because we want him to be regular, and talk to him about hypoglycemia signs and symptoms. And then she gave you a clue that you want to talk to my mother about it. So you can give that option as well. So if you at any time you feel that you are not able to understand, don't worry, we will explain each and everything to your mother as well. And also regarding mother, it is important when you were covering learning difficulty part, at that time you can ask her with whom he is living, who is taking care of him. So at that time you can also mention this point, that I will be explaining all these things to your caregiver as well. Don't worry about that.
Yes. Yes. Correct. Correct. I can do that.
Okay, in this way you will complete the station. I think most of the things, even if it is 1 minute left, then you can give the layout. What are the things that you need to talk about further? So you can remember this mnemonic if you are good with mnemonics. Otherwise, everybody is having their own structure, their own approach. So go with that and cover the station. Don't forget the structure in the meantime.
Yeah. Okay.
But it was a good attempt, I would say.
Yeah, really.
Yeah, because you were not
Except for
rushing,
the
you were not
Mary,
interrupting me.
I'm worried about the Mary factor, because I was assuming Mary,
Yeah,
and then secondly hypoglycemia. I came to that very late,
yeah,
and
don't
also the
assume.
quantify the dose. Three things I find it quite
Whenever you are
correct.
seeing that BSR is high, think immediately that you are looking for some risk factor for the high BSR. So what are the risk factor? If he is not taking dose medication properly, if his diet is not proper, he is not exercising, there might be some fever flu-like symptom in the recently. So all the things that can lead to high BSR in diabetic should be in your mind when you are in this station. Similarly, if you are seeing high blood pressure in the in your task, then immediately think in that way. You are looking for the risk factor that can lead to high BP. And medication, first of all, medication. If patient is not compliant with medication, if patient is having some side effect of medication and he has quit the medication, that is a very important risk factor. There are many stations of chronic condition like epilepsy, asthma. In all these stations, when patient is non-compliant, patient is bothered by any side effect, they will leave the medication.
Yes. Yeah.
And coping is also important in a long-term condition. So if you think in this station, I know it's not it's a big deal.
Yeah, just 2 weeks wasn't a big deal because
Yeah.
2 weeks.
Yeah,
Correct.
but all the long-term conditions, your coping question should be there.
Yeah, absolutely. Yeah.
Okay, any question?
I think you've answered most of them. I'll have to practice to.
Just let me know when you're ready.
Okay. All right.
Okay, we can start.
Hello,
Hello.
my name is Carlos and I'm one of the junior doctor here in the surgery department. Am I talking to Mrs. Catherine?
Yes, doctor.
Okay, how may I call you today?
Catherine is fine.
Thank you, Catherine. Just could you please confirm your full name and date of birth, please?
Yeah, my name is Catherine Joint and my date of birth is ABC.
Thank you, Catherine. And your current address, please?
Yes, doctor. My
Yeah.
current address is 3 Hardman Street, Manchester.
All right. And is this the best phone number because this line broke up?
Yeah, doctor.
Okay, thank you so much, Catherine. Well, I can see that you have some concerns, so I'm here to address all that. How can I help you?
Yeah, doctor, actually, it's about my cancer. I don't want the surgery and chemo for my breast cancer.
Well, definitely we can't make anything against your will, but if you don't mind, can we have a quick chat in order to establish everything in a better way?
Okay.
Okay, thank you so much, Catherine. Well, yeah, I can see from my notes that you have been diagnosed with cancer breast, yeah?
Yes.
2 weeks ago.
Mhm.
And
Yeah, doctor.
and you agreed about the treatment. So may I know what disturbed your decision?
Yeah, doctor. At first, I was not very much aware. That's why I agreed. And then I went to my home and I searched on the internet. And, you know, I have come across a lot of stories where people got the surgery and still they die of breast cancer. So I don't want to put myself through the misery of surgery. And if eventually I have to die.
Oh. It seems that you have been distressed, and I'm really sorry for all your experience, or all what you feel. However, just let me confirm a few things. You disagreed with the both surgery and chemotherapy, yeah?
Yeah.
All right. So has anyone explained you the surgery and the possibility and the chances?
Yeah, your consultant told me that they have to remove my entire breast and then they will give me chemotherapy sessions after that.
Yeah, that's right. But you know, first of all, just let me reassure you that not all type of breast cancer leads to die. However, I think surgeons and consultants discussed with you regarding that. And if you have any queries regarding the possibility of and the chances of success of this surgery, we can address all these. Am I making sense?
Yeah, that's what I'm saying, doctor. Like, I have read that people die even after having the surgery. So this is my main concern, that I don't want to have the surgery.
Well, you know, may I ask from where you read these articles?
Yeah, on the internet, doctor. It's everywhere.
Mm-hmm. You have any experience, any family history of something like that?
No, doctor.
All right, fine. Well, just need to, apart from this issue, and we will proceed. Do you have any other medical condition?
No, doctor.
All right. Well, just need to ask you, the specialist tell you if this cancer spread to anywhere else?
No, doctor, they told me that it's an early stage cancer.
So just confined to the breast, yeah?
Yeah, doctor.
Well, it's great, the possibility of success of this surgery is very good, if we don't undergo for this surgery, some risk factors may happen. This cancer may spread to lymph nodes. It may spread on also to another parts like liver, and the problem would be high. However, are you following me, Catherine?
Yes, doctor.
Yeah, Catherine, however, if we go for this surgery, the possibility of success will be high, and we will keep following you up. You are in safe hands, and we will try our best to remove all this breast cancer,
Well, doctor, I read on the internet that a beautiful lady lost her beauty after the surgery. So I don't want that to happen to me, doctor. I'm a female. I would rather die than to lose my beauty.
Yeah, I understand your concern regarding your beauty. However, I think there's some options like implant, and regarding your beauty, we have very good plastic surgeon, and they can help you regarding that. How does it sound?
Mm-hmm. Okay.
Catherine, you are not alone in this journey and in this tough moment. We are together, our team and you will try to resolve all this issue.
Mm-hmm. Okay, doctor, but it's not just about the losing breast, it's about losing my hair.
Well, yeah, you are concerned about chemotherapy, yeah?
Yeah.
Yeah, many people, if were you, will think like that. However, we can discuss some further options, like there's some further option we can discuss, like synthetic hair. How does it sound?
I don't know about that, doctor. You're talking about hair transplant?
Yeah, no. Just synthetic hair.
Okay.
I can't mention the definite name, but we have some option regarding that, and it will be just temporary.
So you are saying that the hair loss is temporary, doctor?
I'm not quite sure about this, but I will confirm this with my senior. Okay, if that's temporary and resolved after this. Okay.